Hello students, myself Professor PB Sargade, and in our topic human health and diseases, today we will discuss about the last point of this topic, that is addiction. This is a complex condition characterized by compulsive use of substance despite of its harmful consequences. Addiction may involve the use of substances, that is, drugs such as alcohol, opioids, cocaine, nicotine, and others, or behaviors such as gambling. There is specific scientific evidence that the addictive behaviors share key neurobiological features. They intensely involve brain pathways of reward and reinforcement, affecting motivation, which involve the neurotransmitter dopamine. It is important to know that the neurological changes are reversible after the substance use or behavior is discontinued. Addiction overall results in the impairment of physical, physiological, and psychological functions of the body. Causes of substances abuse during adolescence: insufficient parental supervision and monitoring. Second, lack of communication between child and parents, poorly defined rules, family conflicts, favorable parental attitudes towards alcohol and drug uses, expectations from drugs use, and risk taking behavior. Now, the methods and measures to control drug abuse. First, always remember prevention is better than cure. Second, avoid undue pressure. A child should not be forced to perform beyond his or her capacities in studies, sports, and other activities. Third, education and counseling of child to face problems and stress, to accept disappointments and failures as a part of life. Channelize the energy of child in sports, studies, and other constructive activities. Now, the next point in this is drug abuse. Surveys and statistics show that use of drugs and alcohol has been on the rise, especially among the youth. This is really a cause of concern as it could result in many harmful effects. Proper education and guidance would enable youth to safeguard themselves against this dangerous behavior pattern and follow healthy lifestyle. The drugs which are commonly abused are opioids, cannabinoids, and alkaloids of coca. Now the first is opioids. These drugs binds to opioid receptors present in central nervous system and gastrointestinal tract. Heroin, otherwise called smack, is chemically diacetyl morphine. It is extracted from latex of poppy plant, that is Papaver somniferum. Heroin is depressant and slows down the activity of body. Now the second is cannabinoids. It interact with receptors present in brain. Inhalation and ingestion of these substances affect the cardiovascular system. These are obtained from inflorescence and the parts of cannabis sativa plant. Marijuana, hashish, charas, and ganja are other different forms of drug obtained from this plant. And the third is cocaine. This is an alkaloid obtained from coca plant, that is Erythroxylum coca. It increases level of neurotransmitter dopamine. Its excessive dosage causes extreme happiness, irritability, and paranoia. Hallucinogens, that is, mind expanding drugs. These are alkaloids causing daydreaming. Lysergic acid and cannabis are hallucinogenic substances. Atropa, belladonna, and daturo species also have hallucinogenic properties. Hallucination are unreal perceptions of unreal object due to the disorder of nervous system. Now the next point in this is addiction and dependence. Because of the perceived benefits, drugs are used repeatedly. The most important thing which one fails to realize is the inherent addictive nature of alcohol and drugs. Addiction is a psychological attachment to certain effects, such as euphoria and a temporary feeling of well being associated with drugs and alcohol. These drive people to take them even when these are not needed, or even when their use becomes self destructive. With repeated use of drugs, the tolerance level of the receptors present in our body increases. Consequently, the receptors respond only to higher doses of drugs or alcohol, leading to greater intake and addiction. However, it should be clearly borne in mind that use of these drugs even once can lead to addiction. In the absence of any guidance or counseling, the person gets addicted and becomes dependent on their use. Dependence is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if a regular dose of drugs or alcohol is abruptly discontinued. This is characterized by anxiety, trembling, nausea, and sweating, which may be relieved when use is resumed. Effects of drug and alcohol abuse. The immediate adverse effects of drugs and alcohol abuse are manifested in the form of reckless behavior, vandalism, and violence. Excessive doses of drugs may lead to coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. A combination of drugs or their intake along with alcohol generally results in overdose and even deaths. The most common warning signs of drug and alcohol abuse among youth include drop in academic performance, unexplained absence from school and colleges, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationships with family and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuations in weight and appetite, etc. There may be even be some far reaching implications of drug or alcohol abuse. If an abuser is unable to get money to buy drugs or alcohol, he or she may turn to crime. At times, a drug or alcohol addict becomes the cause of mental and financial distress to his/her entire family and friends. Those who take drugs intravenously, that is, direct injection into the vein using a needle and syringe, are likely to acquire serious infections like HIV and hepatitis B. Use of alcohol during adolescence may also have long term effects like loss balance, liver cirrhosis, pancreatitis. It could lead to heavy drinking in adulthood. Chronic use of drugs and alcohol damages nervous system and liver, that is cirrhosis. Use of drugs and alcohol during pregnancy adversely affects the fetus. Another misuse of drug is that certain sports persons use drugs to enhance performance. They misuse narcotic analgesics, anabolic steroids, diuretics, and certain hormones to increase muscle strength and bulk and to promote aggressiveness and overall improvement in their performance. Side effects of the use of anabolic steroids in females include masculinization, that is, features like males, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on the face and body, enlargement of clitoris, and deepening of voice. In males, it includes acne, increased aggressiveness, mood swings, depression and reduction of size of the testicles, decreased sperm production, kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of the prostate gland. These effects may be permanent with prolonged use. The next and the last point in this is prevention and control. The age old adage, that is proverb, is prevention is better than cure, holds true for all addictions. It is also true that habits such as smoking, taking drugs, or alcohol are more likely to be taken up at a young age, more during adolescence. It is best to identify the situations that push an adolescent towards use of drugs or alcohol and to take remedial measures well in time. In this regard, the parents and the teachers have a special responsibility. Now, this was about the drug abuse and addiction. Now, this was the last point in our topic, and here we have completed our topic, human health and diseases. Thank you, all of you.